So let's talk a little bit about our patient today. He's a 30-year-old gentleman who started noticing his hair thinning over the top of the scalp about 8 years ago. He was able to get on medical therapy with his regular dermatologist, and so he has been taking finasteride, and now he's taking dutasteride as well as oral minoxidil. However, as you're going to see, it's still not giving him the results that he wants. And he really just is anxious to get back to a regular lifestyle where he doesn't have to feel self-conscious or wear a hat to cover his scalp. Our objectives for today's hair transplant case is to harvest individual 1 to 4 hair follicles from the occipital scalp via the FUE technique, or follicular unit excision. And the goal of this is going to be to allow our patient to wear his hair very short in the back. So he won't run the risk of having a traditional linear scar that is associated with the FUT method of harvesting hair. And then what we're going to do is prioritize grafting the frontal 2/3 of his scalp, because that's what frames the face. And if we try to fill in the crown first, then sometimes it can create cosmetic problems later for our patients if they have ongoing thinning of the surrounding areas or if the hairline drops. It's not impossible that we may transplant that area in the future for him, but at this stage of the game, with him being already a Norwood 5'6" at the age of 30, we want to make sure that we really shore up that frontal hairline for him first and make sure that we reframe the face. And then we can usually rely on the medical therapy to also help fill in that crown area. And if he decides he wants to do a subsequent procedure later, that's always an option. I'm really excited about today's case. We definitely set out our goals as we had intended. We were planning on harvesting over 1,500 grafts from the occipital scalp of our patient, and we ended up using a 0.95 millimeter punch. Usually that is a good size starting punch, and if we get good quality grafts, then we just roll with the case. And in our gentleman's case, he had majority 3 hair groupings, which is fabulous. He also had a significant number of 2 hair groupings, so we spread those out nice and evenly over the frontal 2/3 of his scalp. And then we concentrated the single hair groupings along the very front hairline. And that's something that's very important in terms of creating a very natural appearing hairline. So there's going to be more of appearance of density behind the hairline, but we want it looking nice and soft and natural toward the front. Overall, it seemed like the patient had a good experience. We were happy that he was happy. At the end of the day, you know, there's nothing better than having a smile on your patient's face. And I love it when they say that it was easier than they had expected, because, you know, overall, I think hair surgery can be a somewhat intimidating process. We like when patients have a good, easy experience overall. So it was a great day, and we're looking forward to seeing his results. His next visit is going to be at the 1-week mark, and we'll keep you updated on his progress.